I'm specializing in joint replacement surgery, which is like total knee replacements and total hip replacements. And so what I typically recommend patients is, let's say they have some dental work coming up, and they also have a joint replacement coming up. I usually tell them, hey, you know what, you should get your dental taken care of first, usually about 30 days before having surgery, because that's very important to mitigate the risk of infection.
And what type of potential infections can there be if a patient had uncontrolled periodontitis, gum disease, or other abscesses, infections that are in the mouth?
Yeah, we're just trying to mitigate the risk of sepsis. So, for example, let's say you got a joint replacement. You have metal and plastic in your body, and unfortunately, bacteria love to hide behind foreign material. And so, if you had a bad infection in your mouth, and it got uncontrolled and went into your bloodstream, you got sepsis, it's going to want to go and spread to the metal. So we're trying to get those things taken care of first. So if you have an infection in your mouth, we recommend getting that addressed immediately.
And speaking of infections and how to prevent infections from happening, so for patients that need a lot of extensive dental treatment, what are some of the precautions in terms of antibiotic prophylaxis that patients should be aware of prior to getting dental?
Yeah, good question. So if a patient had a knee replacement or a hip replacement, we do recommend getting antibiotic prophylaxis at least an hour before for any invasive dental procedures. And that can be, anywhere from even a dental cleaning to a root canal to more extensive treatments. But, if a patient had a knee replacement or hip replacement, I think just to mitigate risk of infection, get the antibiotic prophylaxis.
And for patients that have hip or knee replacement history, how long should they be taking those antibiotics before dental treatment? Is it for 5 years? Definitely.
I think the guidelines are changing. I think there are newer studies coming out saying maybe it's not really needed. But, classically, I think from what I learned from my mentors is that for at least the first couple of years, you should take the antibiotics. Now, if it were me, if I had a joint replacement, I would probably take it lifetime, for prophylaxis. I think it's low risk and high reward. It's just usually just one dose, 1 hour before, and it's not something that you're going to be taking for, days on end.
Thank you. So one of the things that we're really trying to push in Adventist Health is medical dental integration, and what that means is a more closer collaboration between dentists and physicians of all specialties, and how dentistry can relate to each specialty. Why do you think they've been historically siloed, and what needs to happen to really make that bond stronger moving forward?
Yeah, I'm not sure why they've been kind of separated previously, but I think in order to kind of have a closer connection, we need to communicate. We need to maybe have a system where we can, see or hear what each of us are thinking about each patient. So, in order to better take care of a patient from a full body standpoint or holistically, I think us staying in communication with the dentist is probably the best first step.
Great. Thank you. I just want to thank you for your time and a lot of valuable information and important information for our patients on both sides to have moving forward. So thank you so much.
Thank you. Appreciate your time.
Yep.